When can I return to normal activities? So usually the day after surgery for RLE and ICL. Cataract surgery kind of depends when your vision will heal, and it depends on the severity of your cataract, the density of the cataract, and that may take a week or so. But for RLE and LASIK, ICL, typically it's the next day. We expect you to be more than 80% of the way to your ultimate vision by the day after surgery. So a huge step forward from the day of surgery to the next morning when the dilation wears off and you're seeing now near and far. I'd say you can drive yourself. Usually you're driving yourself the day after surgery. You're reading your cell phone, your computer vision, your distance vision should all be there. It may not be, 100%, right? Because it's a new technology, and with any new technology, there's going to be a adjustment period, and so much of vision has to do with the brain and how the brain interprets the signals, the new signals. So for some people, it's 100% the next day, and they're super happy. Other people, it just takes time. It takes time to adapt. So we say usually by 2 weeks after surgery, you're 90% of the way there, and then 1 to 3 months after surgery, the rest of the way. So give it time if it's not there initially. For a lot of folks, it's not. It's going to take a little time, but don't worry. Everyone gets there. Now, if you're off target, and I've said this many times, if you're off target, which means the predicted lens is not the right power for your eye, because the variable is the effective lens position. This lens is now, sitting a little more forward, a little more back. Don't worry. We're just gonna have to give that time. We'll give you temporary glasses or contacts to wear. This doesn't happen very often. 1 in 20 patients or less, but we just have to give it time, and at maybe the 3-month mark when we see that the refraction is stable, and if it's significant, we can remove the lens and replace it with the right powered lens. And usually the next surgery is, we have all variables accounted for. Everything's constant, so it's very easy to back calculate the lens to the right fit for your eye to address that suboptimal outcome. Alternatively, you can do LASIK surgery or PRK, and some people prefer to do that. It's quicker to do, but other folks fear that there's going to be tissue removed, and it can cause dry eye, and that's fair. Those are legitimate concerns. So I typically do intraocular lens exchange to address residual refractive error. Sorry, hope that helps. I'm sorry, I forgot what the question was. We took that was about when can I return to normal activities. Yeah, usually by day. Usually night off to some degree, but the day after surgery. Well, okay, thank you.